In sub-Q fluids, a special solution of fluids and electrolytes is deposited into the loose pocket under your cat's skin. These fluids will be slowly absorbed into your cat's bloodstream.
Chronic kidney disease are constantly losing a lot of fluids through their kidneys. And many times they just can't keep up. They just can't drink enough to maintain hydration.
Giving subcutaneous fluids is surprisingly easy. Most pet owners quickly become comfortable giving the fluids at home. Begin by gathering the supplies prescribed by your veterinarian. This typically includes a bag of sterile fluids, a drip set, and a sterile unused needle. Make sure the fluid bag is at room temperature so that the fluids will be comfortable for your cat.
Bahan yang dibutuhkan untuk menginfus adalah cairan infus yang berisi natrium, kalsium, dan lain-lain. Harganya sekitar 6.500. Ini merupakan infus generik. Yang kedua adalah selang infus. Harga selang infus pun cukup murah, sekitar Rp5.000.
Open the packaging for the fluid line and remove the cap from the tip of the insertion port. Remove the sleeve from the end of the port on the fluid bag. Without touching the sterile port, push the tip into the bottom of the fluid bag. Hang the fluid bag. Twist and remove the cap from the hub of a new sterile needle. Push the hub of the needle securely onto the end of the fluid line. Remove the needle cover. Open the fluid line by rolling the clamp downward and let the line completely fill with fluids. Reclamp the fluid line and recap the needle as shown to keep it clean. Mark the bag with the amount of fluids you will be giving so you can easily see when you have given your cat the prescribed amount. The fluid set is now assembled and ready for use. Find a good location to give the fluids. Often the best spot is one where your cat will be most relaxed, such as on the couch while you are watching TV, or use a flat surface like the kitchen countertop. Don't be afraid to experiment a little to find a place that works best for your cat. Until you become comfortable with the procedure, you may want to ask a friend or family member to help hold your cat. Once you have selected a location, hang the fluids. You might want to use a coat hanger to hold the fluid bag. Keep in mind that the higher the fluids hang, the faster they will flow. When you're ready, remove the cap from the tip of the needle, being careful not to touch any part of the sterile needle. Using your non-dominant hand, grasp some skin over the neck and gently pull upward to create a little tent of skin. The triangle of skin at the base of the tent is where you will insert the needle down into the subcutaneous pocket. Avoid inserting the needle across the tent, as this can result in the needle going in one side and out the other. In one smooth motion, pop the needle down into the skin tent. Hold the needle in place by lightly pushing it flat against the skin. Rotate the clamp to start the fluids. As the fluids begin to flow, you should soon see a bulge under the needle where the fluids are accumulating. If the area fills quickly and your cat becomes uncomfortable, it's okay to administer the other half of the fluids in a second spot. When you've given the prescribed amount of fluids, clamp the fluids off and remove the needle. If a small amount of fluid leaks out or you see a little drop of blood, that's normal. Remove the used needle from the fluid line and replace it with a fresh needle for next time. Used needles shouldn't be thrown into your garbage, so ask your veterinarian how you should dispose of the needles. The entire procedure should take about 5 to 20 minutes, depending on the amount of fluids that must be given and the size of the needle used. Afterwards, it's a good idea to give your cat a treat or his favorite reward. This will help him associate the fluids with something pleasant.
Many people are nervous about subcutaneous fluids. What you'll find when you try it is that with proper coaching from your veterinarian or veterinary staff, that it's easy. The cats don't mind at all, and it really does make a difference. This might be the most important thing that you can do at home to help keep your cat alive.
Caranya yaitu dengan mengelus-elus punggungnya agar tidak sakit. Kemudian ditarik kulitnya. Kita lepaskan jarum suntiknya. Ininya ditarik di sini. Sini tengah-tengah, jangan sampai menembus badan. Di sini ada air, ada gelembung udara. Nah, gelembung udara ini dapat sangat menyakitkan. Sehingga sebelum melakukan penginfusan, kita hilangkan dulu gelembung-gelembungnya sampai bersih, terus dikocorkan.
Ground, and it's filling the entire length of that IV line. We're seeing the fluids come out the other end. That's a good sign. Now you're going to take the clip and slide it down. That stops the flow of the fluids by crimping the line. Notice the fluids have stopped. You're going to keep that end sterile as well. Keep it covered. Now you're going to remove the cap at the end of the IV line and insert the needle and give it a slight twist. This is a locking system, twist it on, and it prevents the needle from slipping off. We noticed a few bubbles in the IV line. If these bubbles were given subcutaneously or underneath the skin of a pet, it will do no harm. But I just turned on the fluids a little bit and allowed those bubbles to be flushed out of the line. And now we're crimping the line up again. And the line is now prepared to be given as a fluid injection. Here we go. Anywhere where there's loose skin, you can insert the needle. Most of the time, pets don't even notice this is being done to them. This is usually a two-person job, so you're going to tent the skin and insert the needle. The needle is draining from the bag down into crystal. From full down to the 1, that's 100 mLs. Now from the 1 to the 2, that's another 100 mLs. Roll that little knob down, remove the needle, put your finger where the needle used to be so the fluids don't leak from the patient. You can recap the needle, unlock the needle, and then apply a new needle so that you're ready for the next use. At the location of the injection site, there's usually a pocket of fluid. It feels like a bump, and that will absorb into the patient during the next few hours. And for patients who are not very dehydrated, later on in the day, you may notice that the fluid may have moved to the underside of the pet.